You're listening to Discover Stories on Reimagine Radio, brought to you by the Vancouver Adapted Music Society. To learn more about accessible music programs and opportunities, please visit our website at VAMS.org. That's www.vams.org. Now let's get into today's episode. Thank you so much for joining us today.
Thanks for inviting me, Manisha. So a little bit about myself. My name is Kiran. I'm a young person living with spasmodic dysphonia. It's very rare, especially for my age, to have this disorder. And I'm a university student. I'm currently working as a support worker and occupational therapy assistant. And the way I would describe my voice, without the Botox, because Botox helps me speak normally, but the way I would describe it, would be very hoarse, like strangled. Imagine your voice, if anybody has had laryngitis and lost their voice, imagine trying to speak through that, and a lot of tension, breaking between words, stuttering at the start of some words. That's how I would describe how my voice sounds, which is very, very like sick.
Yeah, wow. I can't imagine talking I recall every time I'm having a cold, I'm like, I can't wait till I feel better, so I can speak. So I can't imagine just not being able to use your voice for days on end.
Yes.
Wow. So when did you first start noticing something was different with your voice? And then how did you get diagnosed with spasmodic dysphonia? What was that journey kind of like for you?
So my journey was very, very long. It took a lot of years. I think, in my opinion, it progressed very slowly and then kind of just whoosh, just started so in 2016, I got laryngitis, and I remember I went to a concert at that time and I lost my voice. I was sick and I went to the concert. So then afterwards, I lost my voice. It took 2 weeks to kind of recover from that. And ever since I got better, I noticed I had two symptoms that kind of stayed, and I still have them to this day. Like the lump in your throat that you get when it's harder to swallow, like you feel like there's something kind of there that needs to be coughed up. It might be a little bit
right?
gross to hear. Yeah.
Yeah.
And then thicker spit. So sometimes many smokers will have thicker spit. I noticed that. So it's something that I noted, but I didn't really think it was a big deal. I was also younger then. So, I mean, my voice was fine. So, aside from that, nothing really to worry about. And then, the years went on, and I remember in 2019, I had a presentation for one class. Um, I didn't feel nervous or anything. I knew I was a little underprepared, but I went forward anyways with the presentation. I've done presentations before. I've never had an issue with my voice, or the nerves are there, but they subside as you continue on with the presentation, right? So I'm doing this presentation, and it was the weirdest experience because as I heard my voice, as I started, it it's just sounded like somebody had given me the worst news of my life. I don't know, a loved one passing away, and then immediately just put me on stage. Imagine
Oh, wow.
kind of a grieving, almost about to cry, that kind of voice coming out. And I just remember looking at the class and being and I had to stop my presentation and be I'm sorry, I don't know what's wrong with my voice. And I managed to get through it, but wow, that was very strange and
Yeah.
concerning. So from there, I requested to my doctor, hey, can I please see an ENT or whatever?
Mm-hmm.
I kind of explained like the symptoms I've had since 2016 and now this odd situation. So I went ahead, I saw a speech pathologist and also an ENT, and I was given some like speech therapy, like exercises to do on my own because I,
Mm-hmm.
I couldn't afford like the ongoing sessions. And the ENT had done an endoscopy and she had mentioned that everything structurally is fine. And because in front of them, my day-to-day voice was fine, like nothing had really affected my everyday voice. It was
Mm-hmm.
just that one moment I experienced, right? So I said, okay, if they say I'm okay, then I'm okay. I just kind of I didn't get any answers for that, but I just
Yeah.
took it upon like, okay, maybe I was more nervous than I thought.
Yeah. And that does sound really terrifying, especially
Uh-huh.
since you haven't really experienced that ever. And
Yeah.
then, sorry, I feel like my voice was going away. And then you experience that all of a sudden, and then for them to be like, oh, well, there's actually nothing wrong with you. It's like, oh, and I feel like also with like our current medical system, it's like, oh, if they don't really find anything, they're not going to dig deeper. Like, oh, you're fine, then go off and
Mhm.
like call it a day. So, um, yes, I'm curious to know, like, how did you like kind of further discover like what was actually going on with your voice?
Okay, so that was 2019 where I kind of first went to medical professionals.
Mm-hmm.
And then, they're like I said, everything was fine. So I just went about my life. But I noticed now looking back, at that time I didn't because, when you're stressed with school, you just kind of you'd have to, you're kind of forced to push everything else to the side.
Mm-hmm.
I was like very stressed for years and years. But I noticed after that presentation, I developed a fear for all other
Oh
presentations.
no.
And this was my very last presentation. It was very short group presentation that we um, recorded over like a PowerPoint since this was during COVID time.
Mm-hmm.
And all I had, like the amount of what I had to say was like a 4 minutes recording, right? I spent 4 hours recording that because I became so hyper focused on my voice and immediately it took me back to that moment in 2019.
Mm-hmm.
So by the end of it, I was just like exhausted in tears and that's when I realized, oh, like this is something that's a problem now. And then, I came closer to graduating, and in 2021, like a few months leading up to like when I would finish up my bachelor's, that's when the extreme, like the chronic hoarseness, the strained voice, like really came out, and it almost felt like my body was like, okay, you've been busy all these years. Now you got to deal with this, right?
Mm, wow.
So after wrapping up my studies, I developed this voice disorder, and it feels like out of nowhere, but to me, I feel like it's been progressing like through those
Mm,
years.
wow.
So then again, I went to like medical professionals, and at first I was diagnosed with muscle tension dysphonia.
Mm-hmm.
But the golden treatment for that is speech therapy. And because I couldn't really like afford it, I just continued on and I kept in touch with that speech pathologist and I did like those exercises on my own at home. I didn't see any difference to my voice. So then, really I had to advocate for myself and I requested, hey, please, can I see like another ENT or a very long process. And again, like structurally, everything is fine. I'm not a smoker, I'm not a drinker. There's no damage to my vocal cords. And then eventually I saw Dr. Amanda who is an ENT and like really like like an expert in the larynx. And this was in 2024.
Okay, so just
So
last year.
yes, there she explained to me, um, oh no, I think it might be 2023. Yes,
Mm.
2023.
Still
There
fairly
she,
recent.
yes, there she explained to me that we think it might be spasmodic dysphonia,
Mm-hmm.
and there's no cure. It's lifelong. They didn't rule out muscle tension dysphonia, but they kind of also grouped me into spasmodic dysphonia, which is the best explanation because there's no known cause for it.
Mm.
Um, and the only treatment or like temporary treatment is Botox injections, if it works. For some people, it doesn't work.
Wow.
Yes.
So, I mean, from what we talked about, it's has been helping your voice, like the
Mhm.
Botox. And so, like, do you find that when you are taking these injections, like your voice comes back to baseline, or is it kind of like a little bit less than what it was before?
So it takes time. And I think every time you get the injections, it
Mm-hmm.
affects you a little bit differently. The most recent time it's made my voice like very, very faint. So I actually had to take time off from work because it was so hard to project my voice and be heard. I could still speak very smoothly, but it was like very, very like very faint. Like I'm
Mm-hmm.
like an ant trying to speak to a human.
Oh.
Um, but other than that, I've gotten the injection since March 2024.
Mm-hmm.
So every 3 or 4 months, I need to get them, and it's given me like vocal freedom, even though it's temporary. Like to me, it's given my life back. So
Yeah,
I'm
absolutely.
grateful that it's worked.
And I'm glad it's worked for you as well. I can't imagine not being able to speak, and having to deal with that for almost 10 years now. Like, that is crazy.
Yeah, yeah.
Is there any like common misconceptions you would like to clear about this condition? And yeah, like, is there anything you wanted to share regarding that?
Mm, I would say there aren't really like misconceptions. Like it's a rare disorder, so not that much is known about it, even in
Mm.
research. And also just as like voice disorders as a whole, many people don't know that they even exist.
Mm-hmm.
Most people have before the Botox, most people while speaking, they thought that I was just very sick or like scared or like nervous, and they would ask me, "Oh, what's wrong with your voice?" And especially this is during COVID time, so I feel like people were even scared that
Mm. Oh my
why
gosh,
is this
yeah.
lady going out? You know, she could be at home.
Oh my gosh, yeah. And like I can only imagine like you are not kind of able to even explain like what's going on because like your voice is so like hoarse. And so
Yes,
they're like, okay.
yes. And
Oh.
then I wouldn't say like it's a misconception, but like other times I would really notice. I guess it's just human nature, we're social beings. Maybe it's coming from a place of like wanting to help that person out, like in understanding. So I would notice when I'm trying to speak, because my speech was slower and then it was like breaking in between, it was very hoarse and hard to understand me. People would like try to catch on and then they would try to finish my sentences.
Oh my
And I just
gosh.
felt like very invisible, I would say,
Yeah.
even though I knew it wasn't coming from a a bad place, right?
Mm-hmm. Yeah, they didn't
Mhm.
have malintent, but they're
Yes.
trying to essentially speak for you, which is also, I can imagine, like taking away like your voice in a
Yeah.
symbolic way.
Yes.
Oh. And then also just going back to the treatments, I know you talked about Botox, and that's pretty invasive because you have to get like the injection done. You said every 3 to 4 months?
Mhm.
Yeah. Other than Botox and speech therapy, is there any other treatments available for this?
So from what I've searched, because I did do a lot of research, I think there is like a surgery that you can get, and sometimes it can be successful for some folks, and then for other folks it might not. There might be complications afterwards. But from the groups that like I'm involved in and stuff, it's usually just Botox that's
Hmm.
recommended. Nothing else is like really explored, because I think there at the moment there is nothing else. It's just Botox. Yeah,
Wow. Well, hopefully in the future there's something that's
yeah.
invented that's less invasive.
I hope so.
Yeah, and what do you kind of wish more people, including doctors and therapists, understood about living with spasmodic dysphonia?
Mm, I would say for like those who aren't medical professionals, I would say knowing that someone with a voice disorder isn't sick.
Hmm.
Um, and just before giving your suggestions on what they should try, or who they should go to for medical advice or whatever, like just ask them, like, hey, like, can I suggest something to you? Because it gets like overwhelming along
Hmm.
with like all the comments about your voice and stuff. Because I believe that most people are trying to do whatever they can, like just like I was trying to do. And then for medical professionals, I would say trying to keep in mind that the body and mind is like connected.
Hmm.
I would say like I know in Western medicine it's changing, but like it's just kind of like uh the systems in our body are thought to be like part like separated, right? Like not
Hmm.
really interacting with each other. And then also reminding themselves like to be empathetic when they're listening to their patient and like just how they approach their suggestions on like where to take treatment and like how to go about like what the process is and stuff, because sometimes I've been delivered news that's like I felt like was like kind of cold,
Hmm.
but I understand that like they've, especially when they're specialists, they're so used to seeing patients come in with
Yeah.
the same symptoms that for them it's like it's not like a big deal, but for a patient who's experiencing this for the first time, it's like very scary. So
Hmm.
I just wish even like a little bit of conversation,
Yeah.
would kind of help ease the patient.
Yeah, no, absolutely. I feel like a lot of medical health professionals are really like, I guess, numb to like the diagnosis. They're like, oh yeah, you have X, Y, Z, and it's like, oh, I'm just delivering this information. But yeah,
Yeah.
sometimes I think just even having a little empathy around delivering that
Hmm.
information can be so helpful to
Yeah.
the person receiving it, for sure. Um, I know you talked a little bit about how it's impacted your life. Maybe if you can speak about how it's impacted like your relationships and like what has been like the most challenging part um, of living with um, spasmodic dysphonia.
So it's just life changing
Mm-hmm.
in every way that you can imagine. Our voices are so much of who we are. Everyone has a unique voice. Um, like think about how we convey joy, fear through our voices, right? And how people can tell apart one another, like just from their voice. So
Mm-hmm.
it's a big part of your identity. And regarding relationships, like I became so isolated. I didn't want to go out. I didn't want to see my friends. Um, I didn't want to speak anything that involved speaking because it would be like exhausting mentally, emotionally, and like physically. I would feel a lot of pressure.
Mm-hmm.
I just became like, I think that's the least I've ever spoken in my life.
Wow.
Past 3 years before the Botox. Parties, like if I ever came out to your party during that time, just know that it took a lot of effort, like emotional, mental effort to like bring myself to like get out of the house.
Mm-hmm.
Family, it caused a lot of like tension because I knew certain family members that they cared and they would suggest things to me, but it would be putting a lot of pressure on me and just this feeling of I couldn't think about the future and I wasn't even living in the present and I wasn't even living in the past. Like I don't know how to explain it. When I look back, I think I can't remember what I did
Mm.
those 3 years. I know I only focused on what would help me and like trying different things. Yeah, it did affect every task that you need for like daily living, even phone calls. Phone calls were the hardest because you have like another barrier.
Yeah, no kidding.
Um, in person was a little bit easier, but I dreaded phone calls and I would like be literally if there was like a live chat option, I'd be like jumping for joy. It's like, thank God I don't have to make this phone call. Um, Everything. It
Wow.
affects everything. Professionally, I couldn't work, so I haven't before the Botox, I didn't work for those 3 years. I couldn't study because, going to class, communicating with classmates, asking your professor questions, everything, so many things in our life involve the voice.
It's like one of those things where everyone does like without even thinking. Like you talk without thinking and like
Hmm.
when you're a toddler, like you start like using your voice to communicate with like your parents of your needs and wants. So it's like I can only imagine how like isolating that must have been for you those past few years.
Hmm.
Um, wow. Well, thank you for sharing that. I truly do appreciate that, Karen. Thanks for tuning in to Discover Stories on Reimagine Radio. If you enjoy our content, please support us by subscribing to the YouTube channel or following us on Spotify. See you in the next episode.